longer. For example, when the doctor talks about the fact that cancer patients don't even need aspirin, gentlemen, that's almost unbelievable. Nobody in the world would have believed that 10 years ago. And when I first made the statement, you know how they laughed and laughed and laughed. But here a man in class says they don't even need aspirin. He must be helping a great deal when he does that. And when you are working with intractable pain, if you have to renew the suggestions at short intervals, after all, doctor, you would give your drugs every 2 or 3 hours, wouldn't you, if the patient needed it and you'd think nothing about it? Well, suppose you have to renew the suggestions every day or two. I'm sure that our doctor over here, who's been successful with those carcinoma victims, can't say that none of them had the pains come back. Is that right, doctor? They must have come back a little bit, and you had to reaffirm the suggestions. Is that correct?
Well, when I said relief of pain, I'm doing other things with it.
Oh, sure.
The thing is, it certainly made everything else work so much better.
Sure.
And then before I started doing anything, I don't keep them about 24 hours the most. I've never kept anybody free longer than that.
Well, isn't that nice that you're able to keep them for 24 hours? And, doctor, you'll meet patients, if you specialize in that field, I believe you do, where you'll be able to keep them free of discomfort for as long as a week, 2 weeks, 3 weeks. All the time they can be having other therapy, but you'll find it unnecessary to review the suggestions, or to renew the suggestions at such short intervals. That's right. Now, gentlemen, despite the fact that waking hypnosis can be used in every branch of medicine, I think the use of waking hypnosis in deep surgery is where waking hypnosis comes into its greatest value to the doctor. In alleviating the worry and distress of the patient before the operation, there are very few patients who face operations without a certain amount of wonderment, anxiety, and fear. Every one of these patients is wide open to waking suggestion. Make your suggestions in such a confident, assured manner that you can see visible evidence of the disappearance of the unpleasant anxiety signs. Stay with waking suggestion until you know the patient is ready to face the operation in the proper spirit. Lock the patient's mind around the idea that recovery will be swift and sure, that the operation is not an extraordinary one, but that it is done every day of the year in countless hospitals throughout the land, and patients always recover from it fast. And then use waking hypnosis to remove post-operative discomfort. The patient has had the operation and is now in great discomfort, exceedingly worried and anxious for recovery. Therefore, once again, the patient is wide open to waking suggestion. Use it. Now, heretofore you've heard me say, get the patient into the hypnotic trance for your pre-surgical visits or for your pre-anesthesia visits. Now you find that you can do it without the trance. And gentlemen, you can do it so effectively without the trance. I am not saying you should forego the trance. No, I am not. But I am saying this, that if there is any doubt in your mind, or if you don't have time enough to go for the trance state, use the waking hypnotic state and lock the mind of the patient around the idea that recovery will be swift and sure, that the operation is not an extraordinary one, but that it is done every day of the year in countless hospitals throughout the land. Lock the patient's mind around the idea that patients always recover from it fast. Lock the patient's mind around the idea that there will be no post-operative discomfort. Lock the patient's mind around all the things that are worrying the patient, and if by any chance that patient indicates to you that he has an expectancy or the thought that he will not recover from the operation, cancel the operation, or cancel your part of it at any rate. For it was about a year or two after we began teaching this subject that an FACS man came to class and said, you know, I think I saved a life with waking hypnosis this past week. And of course we all kidded him. It was the first time I'd ever heard a man make a statement like that. And I'm pretty sensible about hypnosis. I won't allow myself or anybody else to go overboard on the subject of hypnosis if I can avoid it. And so I started kidding him myself. I said, oh, doctor, you're just over-enthusiastic, and when you come to your senses, you'll realize hypnosis had nothing to do with it or anything else. But he said, wait a minute, wait until you hear the story. And this is the story he told before a class that was composed of just as sincere students as every one of you. He said, I was called in to do a prostatectomy on a little Jewish man about 76 years of age. I was told that he was a cardiac case and that he couldn't take much anesthesia, if any. I've been in the habit of making preoperative visits, but I thought in this case I ought to make a sincere effort to see that that man was in the right mental state before I proceeded to do the operation using the Mayo technique and with as little anesthesia as possible. So I go up to see him, and I introduce myself as the man who will be in charge of the surgery in the morning and so on. And I start doing what Dave told us to do, locking his mind around the idea that recovery will be swift and sure, all that sort of thing. All of a sudden he looks up at me and says, you know, doctor, I'm 76 years old. I'm an old man. I've lived a long time. I'm a cardiac case, so tomorrow I'll die on the table. Well, I said, wait a minute. A minute ago you had surgery scheduled for the morning. You may have surgery scheduled, but you certainly don't have a surgeon to do it, because I am out of this case right this minute. I will never operate on anybody in the world who has a thought that they're going to die on the operating room table. I've never had that happen to a patient of mine in my lifetime, and I'm certainly not going to start with you. And he says, I saw a look of relief come over the old man's face. He says, but look, doctor, I'm a cardiac patient. He says, that doesn't matter. He says, you're 76 years old. I've done this operation on men in their 80s, and they're now in their 90s, and they're walking the streets of Jersey City just as healthy as men of their ages could possibly be. You're a child compared to them. You're only 76, and you're thinking of dying because of a simple operation like a prostatectomy. But I'm a cardiac patient. I couldn't have anesthesia. He says, all right. You think you can't have anesthesia. That's what I came up here to show you. And he says, since you don't have surgery scheduled for the morning anymore, I'll just show you what you missed. I'm going to show you the anesthesia I would have used. And he says, then I got him into the trance state of hypnosis, anesthetized his entire body, and he took the suggestion like a drowning man clutching at a straw, and he had complete anesthesia over his entire body. Then I had him open his eyes and make tests over his entire body. Pinch yourself, do anything, try to get feeling into any part of your body. And he couldn't feel anything. So then I closed his eyes again, brought him out of the state, and he looked up at me and he says, you know, doctor, with you for my surgeon, I believe I could get well. He says, of course you could get well. And then I began to really lock his mind around the idea, and finally when he looked up at me and he says, it's all right, doctor, you can go ahead with the surgery in the morning. I know I'm going to be all right. We went ahead with the surgery. He has made a perfectly magnificent recovery, and I believe I saved a life, because I really believe that I had encountered the will to die, and that man would have died on the operating room table the next day if not for the waking hypnosis. Well, some of the men agreed with him, because every doctor feels that the will to die is a pretty important thing, and a pretty ugly thing to run across in medicine. And some of the men didn't agree at all. They said, look, you probably didn't help them at all with it. Anyway, there was a difference of opinion. But from that time on, we began having reports from students who told us that they had been able to save lives by changing the will to die to the will to live. Now, a doctor knows that the will to die is encountered quite frequently in medicine. For example, if I ask for a show of hands of how many men in medicine here, and perhaps in dentistry too, have encountered the will to die, notice how frequent it is because I'm going to ask that very thing. How many of you have encountered the will to die in your medical practice? Look at those hands go up, gentlemen, and take a look around you if you don't think it's a frequent thing. And you know how serious it is. For if they do not actually die, recovery is so slow, so terrible, and you never know when they're going to die. For example, last night, the doctor comes up to me, and he says to me, you know, he says, what you say about the will to die is so right. I had a case, just this past week, before you made your talk, I had this case. He says, I didn't know what to do about it. He says, let me tell you what happened. He says, it was ordinary surgery. No man has to die from it. And what did he say that the man had? he mentioned it, but it didn't go through my head as to what it was anyhow. And he says, the first operation was successful. And he says the patient's wife would come into the patient and say, "You look terrible. You look like you're going to die any minute." And he says then the man would have a relapse. And I didn't know how to handle the situation. Finally, I refused to let the man's wife in at all. But when I did that, then he thought he was really taking a turn for the worse. Then we had to do another bit of surgery because it was 5 weeks after the operation, and he burst a blood vessel. He says, you don't do that 5 weeks after an operation, Mr. Elman. He says, that doesn't happen in medicine 5 weeks after an operation. But he burst a blood vessel. We have to go in there and do surgery. So he's dead. He says, I know it was the will to die, and I know darn well that it was that wife's visits to him that put the will to die in that man's mind. Because he'd make a recovery, then she'd make a visit, I'd go in to see him, and he'd be off again. Well, he was feeling pretty disturbed about it last night, and he stayed about half an hour talking about the case. Anyhow, as I started to tell you, we have heard these doctors keep reporting to us the fact that they have been able to change the will to die to the will to live in waking hypnosis. And we didn't believe these reports. That is, we took them with a grain of salt. Were they saving lives or weren't they? And then this remarkable incident occurred which let us see that these doctors were absolutely sincere in their statements. For here is the exact case history. There's a man who is an adept student of mine. He's attached to a Catholic hospital. He has been to about 30 or 40 of my sessions. And when I used to have them in the house, every time he had a chance to get over to attend a class, whether he was in that class or not, didn't matter to him. He'd come over anyhow. And it happened that one night we were discussing the will to die and the will to live. And he says, well, I can tell you something funny, Dave. He says, I encountered the will to die in the strangest place in the world and with the strangest person, with a person I never expected to encounter it in. And he says, I just encountered it. I said, what was that, Doctor? He says, well, you know I work in a Catholic institution. I said, yes. He says, well, I was called in to do surgery on one of the nuns. And I was greatly honored that I was chosen to be the surgeon. And so I thought I ought to make a preoperative visit to her and tell her how honored I was to be chosen. And so I go in to see her, and during the midst of the conversation, she looks up at me and she says, you know, Doctor, ever since I was a little girl, I've had the notion that someday I would die on the operating room table, and I suppose this is it. And I said, oh, sister, wait a minute. A minute ago you had a surgeon, and I was so honored to be chosen, but now you don't have a surgeon because I'm withdrawing from this case instantly. Sister, I have never done surgery on anybody in my life that I thought had the notion that they were going to die on the operating room table. Imagine how I would feel if that actually came to pass after you said a thing like that. I would feel guilty for the rest of my life that I had been responsible for it. And sister, I just don't want that to happen, so I hope you will forgive me, but I will not do the surgery on you. And he says, then I could see a sort of look of relief come over her face. And then I remembered what you had said, Dave, and I began to lock her mind around the ideas that you told us about, that recovery would be swift and sure, that as long as she'd been in the hospital, she'd never known of a mortality for this particular type of operation, and locked her mind around the idea that recovery would be swift and sure and all that stuff. And finally she looks up at me and she says, you know, Doctor, I just know I'm going to recover with you for my surgeon. You can go ahead with the surgery. And he says, Dave, we went ahead with the surgery, and she's done beautifully. She has recovered in a minimum of time, and all is well. But he says, I have a hunch that if I hadn't had that talk with her, something might have happened. I don't know, but something might have happened. Now it's about 3 months later, and he comes back to another class. And as he's saying goodnight that night, he says, Dave, you know that nun on whom I did the surgery? I said, yeah. He says, she's been transferred to Chicago. How is she, anyhow? He says, oh, she's made a perfect recovery. She's going to Chicago in wonderful shape. I don't know whether I saved her life or not, but I still think that I had a lot of influence there that day. Now it's about 3 months later. And he comes in and he's crying. Tears are running down his cheeks. And he says to me, Dave, it didn't have to happen. It didn't have to happen. I said, what didn't have to happen? What's the matter, Bill? He says, that nun in Chicago, what happened to her? Well, she had to have a little minor surgery done, Dave, and yesterday she died on the operating room table. And then he went on and said, if I'd have only known, if I'd have known she was going to have the surgery, Dave, I'd have called the surgeon there. I'd have told him my experience with her. Dave, she didn't have to die. She didn't have to die. And then he broke down, and you should have seen the sobs that racked that man. For within himself, he felt that he could have done something. He could have actually prevented this death from occurring if only somebody in Chicago had said, tomorrow Sister so-and-so is going in to have this done or that done. Because he said it was the most minor surgery in the world, and she actually died. From that time, we began to have respect for what the men were saying. Those of you who have encountered the will to die know that it is a horrible thing, but I can tell you this, that it never runs deep. And I think I know the reason why it never runs deep. And why these men tell us, when I try to get a timing from them, how long did it take you to change the will to die to the will to live? Here is what they have told us in every case. Took me 10 minutes, took me 15 minutes. Oh, I don't think I was in there more than 15 or 20 minutes. Oh, maybe 5 minutes. And so when I had had about 50 of these cases reported to me, I began to analyze why it was that the will to die could be changed to the will to live in such a short time. And I think I have the answer. We are born with the will to live. The law of self-preservation is the primary law of our lives. It's a fundamental, it's a basic. It runs straight through our lives. There are only two classes of people in the world who do not have the law of self-preservation flowing in their lifetime as a straight line. That is the suicidal depressive and the manic depressive. All others, it flows straight. It goes straight. It's with us every minute of our lives. What happens when we get the will to die? We can't break off the will to live. We can't bend it. It doesn't bend. What can we do? By our thoughts, we can warp it a little. But since it is a basic instinct, when you get this warp out, or try to get this warp out of the human mind, it's such a tiny warp that it almost seems like somebody is standing at your shoulder, giving you strength to change that into a straight line. It's almost like the hand of God helping you turn that warp thing into a straight line. And gentlemen, every man in this class is capable of changing that will to die to the will to live. When I talk to the psychiatrists who have been in our classes and have said to them why I think it is that we are able to change that will to die to the will to live so easily, they say, Dave, your analysis of the situation is pretty apt to be correct. Our experience has shown us, too, that we encounter the will to die in suicides, and it's pretty bad when they have it, pretty bad in the manic depressive. But with all other people, it hasn't reached a dangerous warp, and you can straighten out that warp. If, however, you are working with a psychotic, if you are working with a manic depressive, if you are working with a suicidal depressive, you have to know that the will to die is there before you can do anything about it. And even there, say the psychiatrists, you may be able to help. It's worth trying at least. Gentlemen, know this much, that with waking hypnosis, some of the men in our last class, that is, the last semester that we did, in the same semester that we're doing this year, I have had reports from these men that they have saved lives. I would venture to say that from the last semester alone, students that I have seen again at class that we've had 10 such cases reported to us already. I expect many of the men in this very room will find that they are able to save lives with what you've learned tonight. Well, that's all for tonight, gentlemen. Yes, sure you can.
What about spinal headache? Can you handle that just like other headaches?
I think so. In fact, we have been very, very successful. They don't have to have it if you give a suggestion beforehand that they will just feel wonderful after the surgery, during the surgery, and before the surgery. You'll find that you'll avoid a good deal of that post-spinal discomfort that some people have. How many have used it? Perhaps some of you have already used it on that. Have any of you used it on post-spinal headaches? I'm sure you'll find that men in this area who have already used it for that, doctor. I'm sure you'll find them. Oh, look, bring people that we can work with next week, because next session we go into the compounding of suggestion, which is one of the most important sessions we have. Let's get a report first on what was done with waking hypnosis the past 2 weeks. Let's find out how you did with it. I know you did the delivery and somnambulism, but how'd you do with waking hypnosis, doctor?
This uses the minor thing very effective.
And you did find it very effective. How'd you find it, Dr. Waxman?
Well, I had quite a lot of fun with it, if you want to put it that way, because I repaired cavities and even class 3 gingival cavities with waking hypnosis. I think the gums with some tincture of medicine, told them it was a new medicament, and that their tooth would get numb in their gums, and in half a minute they began to feel it. I told them to bite down on their tooth, see how numb it felt, and they would feel numb. And I prepared the cavity. I didn't do it on everyone, but I did on quite a few, and really terrific results.
You're amazed when it works.
You feel like giggling all the way through it.
But it's a wonderful thing. Now, the ones who haven't practiced with it are missing that. How'd you do with the waking?
I used it with some success.
Good. How'd you do with it, doctor?
I used it with some.
Good. How about you, doctor?
I used it, but not with some good results.
No, you flopped with it, but you did try it. That's an advantage, because having flopped with it, and it doesn't mean you are going to flop with it. It just meant that you flopped with it that time, just like when you start studying hypnosis. Well, you flop a lot of times before you really start to succeed. Doctor, how about you? How'd you do with it?
This, I would say, has been the most valuable for me to date. The children are intrigued with the magic circle.
Isn't that a wonderful thing?
Two families in particular that I can think of, both of them, these children being quite unmanageable. If I can use the term, I don't like to, mass hypnosis, went down as far as a 3-year-old boy who saw that everything was copacetic with his older brothers, and he responded as enthusiastically as the rest of them. As a matter of fact, the parents were convinced that there was a magic potion. The other facets that are coming into play, the one we did light state on some removal of stitches, very good results. And generally, though, I think the waking hypnosis has been the most valuable in pediatrics to date.
But you can use it so fast, and that is one of its many advantages.
Well, I have found that if you throw them off balance immediately when they walk in the room, then get with the rest of it and come back. In other words, as soon as they walk in, you give them the word that something terrific has happened. They get so enthusiastic and carried away waiting to see what is going to happen. Actually, your time with the patient is much shorter.
Yeah. I'm glad to hear you say that, Doctor. How'd you do with waking hypnosis, Doctor?
Well, tried it,
Didn't succeed. Now, isn't that funny? Always that happens at a number 5 session. You'll get reports that are just fantastic. You get reports from others that they tried it and didn't make it work. I think the ones who didn't make it work didn't believe it themselves, because it is so easy to sell. You ask an old student about waking hypnosis, you may use it very little at the present time. But as time goes by, ask the old students how they've used waking hypnosis, and they will tell you. Dr. Milliken wasn't here last week, but here's a man who's used hypnosis for about 35 years, I think, wasn't it, Doctor, that you told me that you'd been using? How do you find waking hypnosis?
Wonderful.
Isn't it a wonderful thing? He couldn't know hypnosis properly without knowing waking hypnosis. Probably the reason he has been a sort of a fantastic operator, I hope you'll pardon that description, Doctor, but you have done some wonderful things with it, is because of the fact that he knows waking hypnosis. Without a knowledge of waking hypnosis, you can't be such a good operator. But with a knowledge of waking hypnosis, you can go very far. The fact that some of you didn't try it, didn't give it much of a chance these past 2 weeks, well, give it a chance. As time goes by, try it. You know the fundamentals of it now. You wrap the mind of the patient around an idea to which he is receptive in the words that he wants to hear. And if you do those three things, for example, notice how in pediatrics it works. First, he wraps the mind of the subject, in this case a child, around an idea to which the child is tremendously receptive. Now, he does it in the words that the child wants to hear, and all of a sudden he's got a fabulous result. And that will work with adults just as it works with children. In fact, this will interest you to know, when I got to Joplin on this go-round, Dr. Scorse, a surgeon, and his wife were both there, and we started talking about waking hypnosis and the magic spot. And Dr. Scorse said, you know something? He says, I even have a magic spot on me. And his wife joined him at that point. She says, yes, and I have one, and everyone in the family, they have 5 children, all have magic spots. The magic spot is a great help to any doctor. You didn't try the magic spot this week, did you?
Yeah.
Did you try it? How did it work for you?
It was fine.
Good. You can do it on adults as well as children. Remember, adults like to have a magic spot, too. Try it, and you'll see how well it works.
The thing that we use more than the magic spot is that there's something, an anesthetic in the
solution, yes.
That
works like a charm. Yeah. But that's what I call the small uses of hypnosis, but it lets you use it right away. The more you learn about hypnosis, the more you want to know about it. For instance, notice the number of old students who come back.
We never give a hypo in our office without hypnosis.
Yeah, well, that's what I mean. You'd find it difficult to practice medicine without hypnosis. That's what I mean. It becomes so... I imagine that's true with you, too, isn't it, Dr. Phillips?
I figure that hypnosis and suggestions use at least 60% of the value of the medical therapy.
Sure. Today we're going after greater depth in hypnosis. I know that during the past 4 weeks, you have been working with somnambulism, and you have been hitting up against problems and problems and problems. For example, here's what has happened to you. One patient will come in, you get the physical relaxation, you have them lose the numbers, and they lose the numbers so beautifully. And then you'll try the same thing on the next patient, and the same thing will apparently happen, and yet instead of getting beautiful results, you find that you've got to give them the same help you've always given them before. Now, the reason for that is that while the two states seem identical, they are anything but identical. They are completely different. Here's what might happen to you. You might have 2 women, we'll say, who are ready to deliver. And each will get the physical relaxation, and each will appear to get the mental relaxation. Yet you'll deliver one person who will feel nothing. You'll deliver the second woman, and you think you've got the same state. And you think that she should feel nothing, but you've got to give her assistance from the first contraction on. Well, gentlemen, you have hit two entirely different states that look exactly alike unless you know your way around in hypnosis. Now, what do I mean by these two states that look exactly alike from the outside, but are completely different from the inside? One is where they lose the numbers completely. That's true somnambulism. And the second is where they get an aphasia, an unwillingness to talk. They'll start counting 100, 99, 98, and then they'll stop talking. You'll think, sure, the numbers are gone. But the numbers aren't gone at all. And when you do that, you're getting an entirely different state. You are getting artificial somnambulism. Artificial somnambulism, I would hate to have anything painful done on me if I was in artificial somnambulism, because it would hurt like the very devil. And there's no sense to not having you know those two different things, because doctor after doctor around the United States and all over Europe is constantly confusing the artificial with the real.